Welcome to eHealth Learning, inspiring professionals worldwide.
Trust is something that almost should go without saying, but it doesn't hurt to address this topic. There's no human relationship where trust is not integral and important. And likewise in the practitioner-patient relationship, anything that you do that improves trust, and that means like keeping your appointments, being trustworthy, acting in such a manner that they can come to depend on you, anything you do to build trust is going to be helpful as far as eliciting a placebo response. Anything that undermines the trust relationship that you have is going to undermine any placebo, like any potential placebo response. Certainty is another topic, and this has to do probably with the practitioner, but particularly to do with the patient. We've all been in that situation in life where you can't make a decision. You're sitting on the fence and you say, should I do this? Should I do that? And you can see this sometimes in your patients. And if you do, then you need to sort of help to nudge them off the fence. Because when you're in that situation of cognitive dissonance, you're being robbed of a lot of healing energy, among other things. And once you can get off the fence, once you explain to your patient, sometimes it doesn't matter what side of the fence you get off on. You just need to get off the fence, and there's a tremendous power that can happen once people do that, and then they can put a lot more of their energy into getting better, into healing. This one here, no big surprise, but it's a very, very interesting topic. This has to do whether or not your patient feels listened to. Dr. Martin Bass of University of Western Ontario in my own province here, he's done a few interesting studies on listening, and one study that he did basically found the most important factor affecting patient improvement was whether or not the patient indicated that the doctor had carefully listened to their description of their condition on their very first visit. There's no substitute for that first impression. So when the patient comes in your door, make sure that you are listening. And when I say listening, keep in mind, listening is an active process, and you can take courses you can read up on active listening. Becoming a better listener, there's a lot of techniques that are involved, and I'm basically a lousy listener. I've had to force myself to become a better listener in life, and active listening involves repeating back what you've heard from your patient, paraphrasing, and questioning them on things. So listening is giving the patient your full undivided attention, but it's not just keeping your mouth shut. It's also knowing when to open your mouth and echo back information as well too. And listening involves not just listening when they come in the door, but listening when you're taking a case history, when you're assessing, and when you're treating them as well too. Adequate explanation of the pathology. John and I talked about this a little bit earlier, but patients come in the door, all sorts of types of people, and some people are they're very methodical. Some people have a strong medical background. Some think along the lines of energy. Some do not have a deep understanding of their body. And you have to always meet your patient wherever they are. You don't want to explain endless detail to someone who's going to get bored by it. But if you have a patient who's an engineer or they have a medical background, they're going to want to know as much detail as possible. So meet your patient wherever they are, but take the time to explain what's going on. And not only explain what's going on, explain what you're going to do, and also to explain what they can do to improve their own situation. And this does a lot to alleviate their anxiety, and there's, once again, lots of studies that show with every one of these concepts I brought up here, there's studies that show that you'll see improved clinical outcomes if you take the time to do this. So as you see as I walk through this, the placebo effect is a little bit less mystical, a little bit less magical than you might have thought. It comes down to some common sense things, but every one of these things I would say involve the art of medicine, the art of manual therapy. You can go to school and learn the science of manual therapy, but you're going to see dramatically improved outcomes if you become better in the art of manual therapy. Feelings of care and concern from the practitioner. Two big names I brought up here: Balfour Mount, who was the father of palliative medicine, and Francis Peabody, who long since deceased, and was known for care and compassion with the patient. And we see lots of studies that show that some were done on they've done in homeopathy, they've done them in acupuncture as well too, where we see substantially improved outcomes if people, if the practitioner is showing care and concern, and it looks like from what we can see, there's the placebo component in both of those things I've mentioned in homeopathy and acupuncture is extremely powerful, because it looks like the efficacy is being called into question on both of them. But the fact that we can see dramatically improved outcomes with care and concern would suggest that care and concern is an important component. There's a great quote here from Francis Peabody. One of the essential qualities of a clinician is interest in humanity. For the secret of the care of the patient is in caring for the patient. Once again, not rocket science.